Hola a todos, muy buenos
Good
días.
morning to all of you, or good afternoon. Thank you so much for connecting today to this press briefing by PAHO on COVID-19 in the Americas. My name is Sebastián Oliel with the Communications Department with PAHO, and this session will be 45 to 1 hour long, and we will be accepting your questions up to the end. As you all know, we have already received your questions via email, and you will be able to ask your questions live and through the Q&A button. Please recall that when you send your questions, you need to include your name and also the media outlet you represent. Let me remind you that we have interpretation into English and Spanish. Dr. Etienne, PAHO's director, won't be able to join us today. Therefore, for PAHO will be sharing with us the current epidemiology in the area, the trends in the region, and he will be also sharing good practices of countries that have been able to reduce transmission of coronavirus. Today with Dr. Barbosa, we have Dr. Ciro Ugarte, who is the Director of the Health Emergencies Department, Dr. Marcos Espinal, the Chief of the Department of Communicable Diseases, and Mr. Sylvain Aldigueri, who is also Incident Manager with PAHO. Let me invite Dr. Barbosa to update us on the situation of COVID-19 in the region.
Thank you for joining today's press briefing. Over the last week, there was an average of 150,000 daily cases of COVID-19 reported in the Americas. Since the start of the pandemic, almost 22 million people have been infected with COVID-19 in our region, and more than 606,000 have died. While these figures pointed to a still surging virus, the situation differs depending on where you look within our region. The Americas are not one uniform place, so it's worth digging a bit deeper to uncover major trends. In North America, COVID-19 cases are steadily climbing as most states in the US, parts of Canada, and some states of Mexico, including the capital, experience spikes in cases. In fact, the US continues to report record-breaking numbers of COVID-19 cases, and we expect it will soon surpass 10 million COVID-19 infections. However, as we look further south, some countries and regions are doing better than others. In the Caribbean, thanks to effective disease monitoring, countries like the Bahamas took swift action, including robust contact tracing, to prevent the spikes reported in recent weeks from blossoming out of control. And with the exception of Belize, Central American countries are also seeing a steady decrease in COVID-19 cases due to ongoing control measures. In South America, Chile, Paraguay, and Uruguay have kept transmission under control and flattened their epidemic curves. And cases in Argentina, which experienced a peak of transmission in September and October, are now decreasing thanks to improved coordination between the provinces. Regardless of the shifting dynamics in different parts of the region, the virus remains a threat and is still cutting too many lives short. The situation in Europe should serve as a cautionary tale to the Americas. It proves that even after controlling COVID-19 infections, countries are still vulnerable to a resurgence of the virus. It also shows that shifting from total lockdowns, as we saw in the early days of the pandemic, to leaving all restrictive measures, as was the case during the summer vacation in Europe, is both unsustainable and ineffective at controlling this virus. Here at PAHO, we have stressed since the pandemic began that the virus will affect different places in different ways, and that each country, each city, and each community would need to adjust its public health response accordingly. The mosaic of different scenarios I just described is evidence of that. However, after 9 months of living with COVID-19, we also know what works. And the more time that passes, the more proof we have that when countries apply certain best practices, they can successfully slow the virus transmission. Today, I'm going to reiterate some of these best practices and spotlight how they've helped certain countries in our region maintain control over the virus. First, countries must have robust disease surveillance systems that can detect the rises in COVID-19 cases everywhere from metropolitan centers to remote areas. Surveillance data is the instruction manual that countries must use to fine-tune their response based on how the virus is spreading. Effective surveillance systems allowed Chile to bounce back after unprecedented spikes earlier this year by tailoring its public health measures locality by locality. Thanks to strong laboratory surveillance systems, Caribbean countries have been disciplined about imposing restrictions and tightening public health measures when there have been new infections, while also keeping tourism afloat. Smaller Caribbean nations have done this especially well, particularly in the Eastern Caribbean. Second, countries must prioritize contact tracing to limit the spread of the virus. Contact tracing must be part of all response plans and should be adjusted according to the pattern of transmission, from sporadic cases to cluster to community transmission. Argentina, Costa Rica, and Jamaica are just a few countries that are doing this particularly well. Third, countries must rely on their primary healthcare system as the foundation of their COVID-19 response. By prioritizing primary healthcare, some states and municipalities in Canada and Brazil were able to adjust their health workforces to meet growing demand when cases increased and to provide care when and where people needed it most. And through its strong universal health coverage system, Cuba and Costa Rica also ensured that COVID-19 care was never out of reach. Finally, countries must prepare for the worst by having such medical teams on call for emergencies. Most countries across our region form emergency medical teams to provide such capacity when needed. We saw this in Uruguay and Peru, when internal teams were deployed to virus hotspots to care for patients and relieve the burden on local clinics and hospitals. In the Americas, more than 165 emergency medical teams were deployed domestically by the countries, enabling health services to expand by almost 17,000 inpatient beds and the 1,500 critical care beds, which have been crucial to saving lives in remote areas. These best practices show us that keeping the virus under control requires both constant commitment and proactive adjustment to ensure our national response reflects changing trends. Throughout this pandemic, PAHO has been working to continually reassess our public health guidance based on the latest evidence and lessons learned. With PAHO's input, WHO has also issued updated guidance so countries can implement and effectively adjust public health measures against COVID-19. While the best practices that I mentioned, some of them today, remain unchanged, the new guidances that have been updated in the last weeks and months offers a practical guide to help countries decide which measures to implement and how long, based on how the virus spreads and the characteristics of their national health systems. We are hopeful that countries will be better able to tailor their response to their individual needs as their caseloads change over time. We have long said that as we wait an effective vaccine and better treatments against COVID-19, countries should expect to see a series of recurring outbreaks, so they would always need to be ready to act. The key has always been to ensure that our public health response are adaptive to the moment. Only then we can guarantee that a few new cases don't develop into full-blown outbreaks. With this evidence-based approach, and by employing the best practices we outlined today, we are confident that countries can stay ahead of the virus. Thank you.
Muchas gracias, doctor Barbosa. Vamos a pasar ahora a
Thank you very much, Dr. Barbosa. Now we will move on to the questions and answers. Please send us your question through the Q&A button and do include your name and media outlet. We have already received several questions related to the vaccine, and they are the following.
On the COVID-19 vaccine, including the positive findings from Pfizer this week and the decision to hold the Sinovac trials in Brazil, how close are we to obtaining an effective vaccine, and how is its safety being assured? And also, what does this new Pfizer vaccine now mean for countries in the Americas? Dr. Barbosa?
Thank you for this question. Of course, that every news that you will receive about the vaccines, about the producers that are close to finish the clinical trials, these are very good news, and I think that they bring hope for not only the countries in the Americas, but for the whole world. But first, I want to highlight that we still don't have a vaccine. So let's keep in mind the public health measures that are being adopted at the national level, at the states, municipalities, and also for individuals. Wear a mask, to keep a distance from 6 feet, to avoid to be in closed spaces with crowds. So this kind of measures can protect you and your family to get COVID-19. Now we have 10 vaccines that are at the final stage of clinical trials, the clinical trial phase 3. Some of them are closing to the end of these trials. After the end, they will need to publish not a summary of the study, but they will need to publish in scientific journals all the data so the scientific community worldwide can double check all the data very carefully if the sample was correct, the methodology, the outcomes, everything that is provided by a clinical trial. And they will also need to present these findings to the regulatory authorities to be allowed to be licensed to sell this vaccine in a specific country, and also to be pre-qualified by WHO if they want to be purchased by the United Nations system, the revolving fund of PAHO, COVAX facility, and others. So it's good to see that the vaccines are very close to finalize this very critical step, but we need to wait to have a full review of the outcomes, the results that they are getting. So it's not easy to establish a data, because after all of this process, they need to produce the vaccine, they need to deploy the vaccine, the countries need to be ready to give the vaccination. But hopefully, we will have a vaccine available in the first semester of 2021.
Muchas gracias, doctor.
Thank you very much, doctor. Now I would like to give the floor to Dora Rodriguez from Radio Gran Rosario and El Último de la Semana. If you can hear us, please go ahead.
Dora,
Dora?
Dora, lo que estás intentando, pero no
I
sé
think
si...
you're trying, but we cannot hear your voice.
No, bueno, la pregunta...
Very well. The question then
de Dora, ella quiere saber
by
qué es
Dora is the following. She says that FDA approved the use of the monoclonal antibody treatment and she'd like to know what PAHO's position is in this regard. Dr. Espinal. Thank you very much, Dora, for your question. Yes, indeed. FDA has authorized the emergency use of this monoclonal antibody. It does not mean that it is full approval. It is a preliminary approval based on several criteria. It cannot be used in every individual affected by COVID. What does it mean? As an emergency authorization, it cannot be administered to everyone, and final results need to be received from the clinical trials being carried out. Let me explain. Approval is based on 465 patients that have been treated with this antibody compared to what we know as a placebo, that is a safe substance, an innocuous substance. So the effect that we have seen is a decrease in visits to doctors, a decrease in emergency visits, but we have not seen an impact on the decrease of the viral load. So it is important to take into account that this trial is still ongoing. These are preliminary data, and we do need to be careful. Second, it is very important to say that this medicine is not authorized as an emergency medicine or emergency treatment in patients that are hospitalized. This is just for individuals that have mild or moderate symptoms of COVID-19. This cannot be used in hospitalized patients. FDA has already prepared a study that attempted to show the impact of the antibody in hospitalized patients, and this also had very strong reactions. And it cannot be used with patients that need oxygen because it has also been shown that there could be very serious and detrimental side effects. So the approval for now is for children older than 12 and adults that have a mild to moderate disease. We do need to wait, and we are also assessing the data because this is the preliminary authorization. It is promising, but we should not lose sight of the fact that we have to receive final data. As an emergency approval, we do not have complete approval. There are other criteria. The FDA has a series of questions and answers on their website that clarify the use of this medicine and when it shouldn't be used. We need to be careful. It should also be used in strict adherence of the decisions made by the doctors. The person cannot be hospitalized, and once again, it can not be used with individuals that have severe disease or that are in need of oxygen supply. So we need to have more information, and as the results are received, we will be able to analyze this better, but it is promising. Thank you very much. Thank you, doctor. The next question is by Alejandro Arco from Plenilunia. He's saying, what are the conditions to be met to declare an endemic disease, and also what would be the measures to be modified if COVID-19 was declared endemic? Dr. Ugarte. Thank you very much, Sebastian, Alejandro, for your question. An endemic disease for WHO is a disease that is present in a community, and we know it as the basic basis level of the disease. It is not the desirable level. The desirable level would be zero, but it is the observed level. So given the absence of any intervention and also assuming that this level of cases is not high enough to exhaust the number of vulnerable individuals. That is to say, there are individuals that could still become sick because of this disease, and we see this at an indefinite level. So the basic level that we see has to be the expected level of the disease. In the case of COVID-19, as you well know, we are still in the pandemic phase. That is to say, the first thing would be for the pandemic to come to an end. And for that, technical criteria are being developed internally, criteria and considerations that could tell us this is no longer a pandemic, this is considered as an endemic disease. But the determination, the declaration of COVID-19 is not something that is going to happen tomorrow, given the intensity of the transmission. We have more than 50 million individuals that have been confirmed as infected with COVID-19, but we have 7 billion individuals in the world. So we're still in the phase in which we need to consider that each disease is different and the criteria used for the various diseases are also different. If we think of respiratory viruses, the criteria are based on exclusion. This is no longer a pandemic. We could say that it is endemic. And as to how to define the natural epidemiological conduct or behavior, could become part of the academic discussions. For example, is it endemic, endemic, epidemic? So we're still in the process, in a very long process. And I'd like to take up this opportunity because we have seen several messages in the social media indicating that this is an endemic disease, but that is not correct. Thank you very much. I'd like to give the floor now to Melina Ochoa, who is a journalist from Mexico. Melina, can you hear us? You have the floor.
Hola, ¿qué tal? Muy buenos días. ¿Me escuchan?
Good morning. Can you hear me? Yes.
Perfecto. Muy buenos días a
Very well.
todos.
Good morning to all of you.
Aquí en México, al
Here in
momento, la
Mexico, right
Secretaría de
now,
Salud no ha dado
the
información
Secretariat of
sobre
Health has
el
not
número de
provided
casos
information
y temas de
on the
riesgo
number of
COVID-19
cases of
en
individuals
personas
that are
enfermas
infected
también
with
aquí con
COVID-19 and
coronavirus.
individuals that also
¿La
have the
OPS ha
flu.
detectado
Has
estos casos?
PAHO
Es decir,
detected
personas que
cases
están padeciendo
of
ahora la
individuals
enfermedad que
that
tienen
have the
coronavirus
flu
al mismo
and
tiempo que
coronavirus at
siguen?
the same
¿Cuáles son
time?
los reportes que han
And
tenido, sobre todo en esta
what
parte
reports have
del
you received
continente,
in
donde el
particular in
invierno
this area of the
pues
hemisphere
ya está
where
por comenzar?
winter is around the
Gracias.
corner? Thank you. Thank you, Melina. Dr. Aldigueri, would you please address this question? Yes. Good morning, Melina. In the Americas, the surveillance systems for the flu that have been in existence for more than 10 years have been used for COVID-19 through sentinel networks and also the monitoring of acute respiratory infections and also by testing at the reference lab level. That is the first comment. The surveillance, the traditional surveillance has been strong. The lessons learned in the southern cone during the flu season there showed us that the flu transmission was almost inexistent, very, very low in the southern cone countries, and that has also freed up some ICU beds to take care of COVID patients. In the northern hemisphere, to date, flu transmission has been significantly lower than what we observed in 2019. However, we should indicate that we are just here in the northern hemisphere at the outset, at the beginning of the flu season. But I would like to highlight that the countries of the Americas and also the countries in the northern hemisphere, Canada, the US, and Mexico are not lowering their guard in terms of surveillance. The number of samples taken for influenza has been higher over the last 4 or 5 weeks as compared to the same period last year. But the number of detected cases, once again, this is the beginning of the flu season, the number of flu cases detected has been extremely low. For the three countries in the northern hemisphere, they have been about 190, 180 detections, isolations for influenza over the last 5 weeks, compared to more than 990,000 cases of COVID cases within the same network. I hope I answered your question. Thank you very much. Thank you, doctor. And the next questions are related to vaccines, and they were sent by Jennifer Redox and Tim Wilson from Nurture America and Catalina Logo Guerrero from Salud con Lupa. Jennifer and Tim are asking the following.
Pfizer vaccine requires storage at low temperature and two doses. How able are our health systems in the Caribbean able to meet the cold chain requirements, particularly those smaller territories with no international airports? Esto se aplica también, lo que pregunta Tim, no solo para...
The same question applies not only to the Caribbean, but also to Southern America. And Catalina Hugo Guerrero is asking, what could PAHO or WHO do to help developing countries have fridges and also proper transportation for this type of vaccine? Dr. Barbosa. Thank you very much. Thank you for the questions. Among the 10 vaccines in phase number 3 are using the genetic material of the virus in 3 of them. And those vaccines, this very new method, there is no other vaccine that has been used anywhere in the world with the same characteristics. So there is no health system in the Caribbean, in South America, in the US, or in Europe that could be ready to handle those vaccines. For them, you need to have storage at minus 70 degrees Celsius, that is about minus 103 degrees Fahrenheit. And so the countries, if they decide to use those vaccines, will need to prepare. The other 8 vaccines are vaccines that can be handled in the current cold chain systems we have in the various countries. So we are in the process of having a conversation with some of the institutions, financial institutions, even to strengthen the cold chains in the countries, because any country in the world to use this vaccine will need to introduce this type of change, or also to acquire new storage units to be able to have the ability to store the vaccine at minus 70 degrees Celsius. For the vaccination rooms, the vaccines do not need to be frozen at minus 70. The equipment at the vaccination rooms that we currently have can be used because they can be stored at 18 degrees for up to 5 days. So the problem will be to have central warehouses and storage units, and there we do need to make an investment. But yes, indeed, this is a challenge for the whole world, because for the first time we are going to have vaccines with those characteristics available. Thank you very much. Thank you, doctor. We have several questions linked to the tropical storm ETA in Central America. Lidia Lopez from La Prensa in Nicaragua is asking as to the importance of the COVID-19 measures in the midst of a natural disaster, and Nicaragua has been affected by ETA, and what should the health system do in Nicaragua in connection with the people affected by ETA? And also, we were asked whether we could update on the impact of the storm and whether this has increased COVID cases, and also what PAHO is doing to that end. Dr. Ugarte, you have the floor.
Thank you. The circumstances of the effect of ETA's effects in Central America and the Caribbean is being assessed as we speak. However, hundreds of deaths have been reported, as well as missing persons, damages to the infrastructure, including damage to health facilities, and there are thousands of of persons that have gone to shelters. PAHO has been supporting in assessing the damage and in helping meet the needs. And we have also sent technical personnel to Honduras, a person to support the coordination of the emergency, an expert in coordination of medical emergency teams and equipment. San Pedro Sula was the first city that was about to receive the first team, and also officers to coordinate projects. And not only that, in addition, experts that have been mobilized domestically to also assess for the increase of COVID cases. Each one of the countries mentioned, Honduras, for example, on November 10th, they received 2 COVID kits with PPE, masks, respirators, hand gloves, aprons, and also dignity kits, as we call them, for people who are in shelters. And it is also expected that by 14th of November, this Saturday, there will be a second shipment with a kit for hurricanes, which include other medications and equipment with renewable energy. There could be a third shipment that will be arriving later. The United Nations system is coordinating a multi-sectoral response, and PAHO is being the leader in the response in every sector. Regarding the specific question asked for Nicaragua, yes, we have continued to recommend that measures should be implemented, such as physical distancing, to prevent a spread of the disease, especially people who are in shelters and those who are um, being mobilized to provide assistance. The health teams that are assessing damages and who are providing medical care to the population should also be in this group with protection. The general population should also be keeping appropriate distance, use of masks, hand washing. And it is true that in conditions such as a hurricane with lack of water, restriction of movement, and with people who are living in shelters, these conditions are harder to meet. But provisions have been made so that in these areas there will be a special display of teams and equipment such as testing for COVID. So when we do testing in those populations that are in shelters, maybe we'll be finding cases and we will take the necessary measures. It won't mean that this is necessarily related to the hurricane, but that the disease has its natural course, and the risks increase in conditions such as these. Also, we are providing support to the health secretariat and the water company to monitor shelters to reduce the spread of COVID-19. And we have also established a a close coordination which will facilitate deployment of health assistance in the form of medical teams under the coordination of medical teams. If we coordinate the emergency for hurricanes with the emergency for COVID is something we're working on heavily. Thank you, Dr. Ugarte. We have some questions related to the antigen tests.
Cartwright, the Tribune, the Bahamas, dice, here in the Bahamas, our testing is low again, and we have eliminated the idea of the rapid antigen tests at ports of entry. Can we get good results from these actions? Y también Melina Ochoa de México
And
quería
also,
saber.
Melina Ochoa from Mexico wanted to know whether the antigen tests donated by WHO to Mexico, when are they going to arrive in the country? Dr. Alighieri.
Thank you for the question from the Bahamas and for the question from Mexico. I will try to combine the answers of this and to highlight common grounds in these two questions. Regarding the Bahamas, you have to take into account that antigen based rapid test is really a game changer that is complementing the PCR that remained the gold standard. It is for use, mainly for use at primary healthcare level, allowing clinics, primary healthcare centers, remote areas to do the testing. But the antigen PAHO does not recommend the use of antigen detection test in asymptomatic patients. So in fact, it's not recommended for travelers whom by definition should not be symptomatic at this moment. And by the way, PAHO does not recommend the use of laboratory testing as the main testing for entry before travel and after arrival into the countries. It creates a false sense of security. PAHO is recommending much more comprehensive health monitoring and information of the travelers related to non-essential travels. So this is one point, but really I'd like to highlight in the Bahamas the complement of antigen test and PCR for a better detection at primary healthcare level, at community level, in symptomatic patients. En lo que corresponde a la pregunta de México.
With respect to the question asked by Mexico, in the framework of the complex logistics situation at worldwide level, the WHO donation of antigen tests is still on the way. However, there's some progress in Mexico. First of all, INRE, the National Institute of Diagnostic Reference, they have already seen that there's a great deal of specificity and high sensitivity, and therefore they will be able to be included in an existing network of laboratory surveillance for use at community level and primary health level. This is not easy to do in a large country with high population as Mexico. Adjustments in the protocols need to be made, and especially for vulnerable populations. I hope I have answered your questions. Thank you. Thank you, Dr. Alighieri. Our next question is from Nadine Wilson Harris.
She says, Dr. Barbosa, can you say why Jamaica has been ranked as one of the countries that is doing particularly well in its handling of COVID-19? And what will be PAHO's mobilization protocol for procurement of a vaccine once made available? And what is the level of engagement that PAHO is having with Jamaican authorities for preparation of a smooth and efficient vaccination program? Dr. Barbosa?
Thank you, Nadine, for these two very important questions. The first one is a very good one because I know that all journalists, you are very curious about how is my country doing? He's the best country in the America, he's the worst. What is your assessment about this? Let me be very clear. We are not ranking the countries in the Americas. We are giving some best practices in very specific aspects. It's not the same to say that they are doing everything well, but in these specific topics that I have mentioned, and they are very important to improve the response, these countries are good examples, and we could have not 3 or 4, but 10 or 12 to share with you. Jamaica, I said that Jamaica, Costa Rica, and Argentina is doing very well in a very important point, that is to trace, to monitor the contacts that you have, because when you do that, you can reduce the spread of the virus, you can interrupt the chains of transmission. So Jamaica, Costa Rica, and Argentina, they are using their surveillance system to perform this very important task. And we are giving these examples exactly to call the attention of other countries to this very important aspect. But we are not ranking the countries. We are not saying that the countries that I mentioned are the best ones in the region. In these particular topics, and these are very important topics, they are doing well. So for this reason, we are recognizing them in order to share their efforts. All the countries are doing the best that they can. They have mobilized the resources. They are fighting against an unprecedented public health crisis. And in every country, for sure, we can have good examples and best practices that we will share in the future. About the second question, let me tell you, PAHO and UNICEF will be the procurement mechanism for COVAX. So it's not a parallel action. We are, with UNICEF, the purchase mechanism for COVAX. So in the next days, we, PAHO and UNICEF, we are releasing, on behalf of COVAX, the first official pre-tender for the vaccine. So we will receive information from the producers about how much vaccines and when they believe that the vaccine will be available and what is the cost. And with all this information, we will review them, and after these vaccines are pre-qualified by WHO, we will start the bidding process. So we are engaged with all countries in the region, and Jamaica is very active in this negotiation, as well as all the Caribbean countries, the countries in South America, in Central America. They are all engaged in COVAX facility, and we are participating in this facility, in this not only with the purchasing process, but also advocating affordable prices for the countries in the Americas. Thank you.
Gracias, doctor. Otra pregunta que
Thank you,
nos...
Dr. Barbosa. Another question is from Linda Stryker from Now Grenada.
Community spread in at least 2 regional OECS territories. What advice will you give to governments and people in the CARICOM region experience outbreaks? The Caribbean is dependent on tourism. How does PAHO view the current protocols for entry? Dr. Aldigueri?
There are a couple of questions within the same question, I think. So I will do my best to address these questions. I'd like first to explain the way that countries and territories of the Caribbean are reporting to PAHO using PAHO WHO guidelines. That there are 4 types of transmission that the countries do a joint assessment with us. No case, sporadic cases, cluster of cases. It means cluster. It means that the surveillance system knows what is the chain of transmission, and community transmission. So at the moment in the Caribbean, we have really very different mosaic of different patterns of transmission, including the countries of the mainland, Belize, that is more related to the dynamics in Central America, Suriname and Guyana, that are more related to the dynamics in the Amazon basin and other countries of the mainland, and the Eastern Caribbean countries. Um, in the Eastern Caribbean countries, community transmission has been reported in French departments and Dutch territories. The English-speaking countries and territories report on no cases during the last weeks, or sporadic cases, or clusters. So the main advice to the countries that at this moment are experiencing clusters of sporadic cases is to be ready and to implement very strong contact tracing activities linked to a strengthened surveillance system, including the laboratory. Most of the countries of the Eastern Caribbean have now national laboratory capacity, and those with no capacity have the option to refer the samples to a Caribbean Public Health Agency. Regarding protocol for entry and testing before travel and testing after arrival, I will link my answer to what I already said with the antigen test, is that PAHO does not recommend the use of laboratory protocol for deciding regarding at point of entry. We recommend the very comprehensive health monitoring of the travelers for non-essential travels, and really the laboratory based protocol gives a false sense of security to the countries. Again, this is at primary healthcare level. This is part of strengthened primary healthcare networks that the battle would be won by the countries in a Caribbean context and also other context. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. La siguiente pregunta.
Thank you, Doctor. The next question is from Jose Carlos Cueto Lopez from BBC World about the vaccine as well. So how is the continent preparing, especially in rural areas, to store and transport a potential vaccine? And is the continent sufficiently prepared for this challenge? Dr. Barbosa. Thank you for your question. And again, this is one of the 10 vaccines which are now on phase 3. There has been an announcement by the manufacturer a few days ago stating that they already have preliminary data, and I underline preliminary, with good effectiveness. But this needs to come to an end first, to be completed, be published, and present the dossier so that an assessment can be done. Out of the 10 vaccines, 2 are very innovative vaccines. There is no other vaccine around like that. And those 2 vaccines are going to require storage and transportation at 107 and at minus 70 degrees Celsius. The other vaccines can be stored in the storage conditions that we already have, but it's not only rural areas, also urban areas. No country in the world is ready to handle that vaccine. So the manufacturer has reported a few days ago in a meeting we had with them that they are developing uh, smaller equipment to transport these vaccines. Storage and transportation needs to be minus 75, but in the health units where the vaccine is going to be used, you can use the same equipment you have today because the vaccine can be stored up to 5 days with the temperature of 2 to 8 degrees, which is the common temperature for most vaccines. So who is prepared in the world? Nobody, because this is the first vaccine ever to have these characteristics. But until that time, when that vaccine is ready with other vaccines, countries will be taking measures to strengthen, to replace, to purchase new mechanisms and new equipment to store and transport those vaccines. But I repeat, nobody, neither in rural areas nor in urban areas, eh, in any country of the world, even the richest countries, no one is prepared for these vaccines. Thank you, doctor. The next question is from Michael Clocks from Pictions Media, and it reads,
issues on the increase with the pandemic, how can families ensure family members with mental health conditions are receiving proper treatment? Dr. Ugarte?
Thank you, Michael, for the very important question, because mental health is one of the aspects of the COVID-19 that we don't pay enough attention, and actually is more common than we expect. As it happens in any emergency, in large disasters, for example, approximately 25% of the population affected may need at certain point some support on mental health. Regarding the persons who a family member with mental health condition, you have to make sure that the person with a mental disorder or treatment continues it, the treatment as being prescribed. So you need to ensure that you have enough stock of medication. For example, have at least 1 month of stock of medication. Avoid treatment disruption, because treatment disruption, of course, may cause the patient to present some of the symptomatology, and also may have a risk of relapse of the situation, of the condition. Continue also with the consultations with the health provider, researching also professionals that are close, and probably the ones that are providing this support through telemedicine, telemental health, and protect the mental health also of your family, yourself, and procure not to be, try not to be isolated and interacting with others, and trying to maintain the physical distancing, but with no social distancing. You have to maintain this, for example, proper diet, sleep, and exercise. When we say maintain the contact with families and friends virtually, and also reduce the consumption of alcohol. And in cases when there are emergencies and other situations, that adversities, use those skills and the practice that you use to overcome those adversities also in these conditions. And because the information sometimes is not accurate, and sometimes the information may create more anxiety, try to look at information from trusted sources, but do not stay longer time looking for that information, because it may also cause some anxiety. And in all times, try to maintain the healthy situation of all the family, particularly the elderly people, the people that cannot take care of themselves, and children and adolescents. Thank you.
Muchas gracias, doctor.
thank you, doctor. Another question also related to vaccines. I think we have already answered these questions from Alina Diaz de ADFP, saying that Pfizer has generated a lot of positive results with their vaccine against COVID. She wants to know what this vaccine means for Latin America. Dr. Espinal, maybe you could answer this question. Thank you, Alina. It's always good news to have hope. The hope that the Pfizer vaccine is effective. We hope it is effective, and it has been announced that it probably has 90% effectiveness. We hope that others will be announced soon. As Dr. Barbosa said, there are about 10 vaccines in phase 3 clinical trials. Pfizer is engaging in bilateral agreements with certain countries in Latin America, Argentina, Chile, Mexico, Ecuador, and they're negotiating with Peru and Brazil because the countries have the possibility to engage in bilateral agreements, or also through the revolving fund and COVAX facility. Of course, we don't oppose any of these because each country is sovereign. The advantage of using the COVAX facility is that there are several vaccines that will be available of all the ones that COVAX will have in its portfolio. When you enter into bilateral agreements, this will be good because if you enter into an agreement for an effective vaccine, that's great. But in other cases, it may be a non-effective vaccine. In this case in particular, Pfizer's results seem to be quite encouraging, and it will require the ultra freeze storage, but PAHO will be working with the countries to make sure that the vaccine, regardless of where it's coming from, it can reach the populations of our region. This is good news. And we hope that other vaccines will be joining this one. We need to wait for results because, as with the antibody cocktails, we have preliminary results. Pfizer hasn't completed the phase 3 trial. There is no emergency approval yet. So the next few weeks are going to be very interesting, and we hope that other vaccines can be announced as well. Thank you very much. Thank you, Dr. Espinal. We are coming to the end of this briefing session. The last question we have for today is this.
What should be done to ensure that those with underlying conditions, such as diabetes, can avoid complications related to COVID-19? Dr. Barbosa?
Thank you for this question. This is a very timely question because next, the 14th of November, is the World Diabetes Day. There are currently 60 million people living with diabetes in the Americas, and even before taking into account the additional risks posed by COVID-19, diabetes that is not well managed can lead to blindness, kidney disease, and even amputations. COVID-19 pandemic has certainly posed an issue to those managing diabetes and other chronic conditions, including the cancellation of routine hospital visits, issues receiving sufficient medication, particularly during the implementation of public health measures that were necessary to reduce the spread of COVID-19, but posed this additional burden on people with some underlying condition. PAHO is working with our member states, the countries in the Americas, to ensure that the care for chronic conditions, including diabetes, remains available during the pandemic. This includes offering care outside traditional settings and ensuring that medicines such as insulin remain accessible and affordable to those who need it. Patients must also be provided with information so that they understand their risk and have access to the necessary tools to manage their disease. This is very important for us, that the countries can, first, they need to use the primary healthcare system that they have, because this is the best way to be closer to the communities, to offer access to diagnosis and treatment for diabetes and other chronic diseases, and also to move for a broader use of new technologies, new platforms, cell phones, telemedicine, teleconsulting that can reach out to people in vulnerable situations. So this is a very important question because COVID-19 is an unprecedented public health emergency, but we also have people with diabetes, with cardiovascular diseases that they have an increased risk for severe conditions, so we cannot forget them. They need to be at the center of our response in every country in the regions. Thank you.
Muchas gracias, doctor Barbosa. Ahora sí,
Thank you,
entonces hemos...
Dr. Barbosa. Now we have come to the end of this press briefing for today, and let me share with you the web page of PAHO where you can go to obtain regional updates on the epidemiological situation, and we will soon be sending you the words by Dr. Barbosa, and I apologize to those who didn't get a chance to have their answers to their questions, but there's always next week. If you need an answer, we will be answering via email. So thank you again and see you next Wednesday. Greetings.